I'm Elizabeth Weldin, and I'm a hand and upper extremity surgeon at Tulsa Bone Joint. What led me to medicine was really the combination of science and humanism. I really love basic science and learning about how things work, but I also really love interacting and taking care of people. So in looking at things, at first I thought I wanted to be a scientist and sit in the lab all day, but then I realized that I was missing that human interaction day to day, and so medicine was really the perfect marriage of those two things. I have moved around quite a bit. My college and medical school was done in Southern California, and through there I found that I really enjoyed orthopedics. I sort of fell into that by mistake. I was running out of time to register for an elective class and got registered into an orthopedic elective and found that I really enjoyed it. From there, in looking at where to train for orthopedics, that led me to the University of Iowa Hospitals and Clinics in Iowa City. After that, I took my first job in Reno, Nevada, which was a great adventure for our family, but we wanted to come back and be closer to family, which led me here to Tulsa Bone Joint. Everything has been so welcoming. We're having a hard time classifying where Oklahoma really fits on the map. It feels very Midwestern to us, which is where my husband and I are ultimately from, but it also has a very southern charm and warmth. So for us, it's been a wonderful combination of something new to experience that feels like home. So what I love about the upper extremity is the diversity. So I can do things like big joint replacements and replace your elbow, or I can do very tiny surgery on babies with congenital hand differences or with a microscope on nerves. So I really love that there's a diversity not only in the technical aspect but also in the patients. I can take care of patients longitudinally as they battle a disease like rheumatoid arthritis, and we see each other over decades, or I can see a baby born with an extra digit that we take care of and that goes off into life and I never see again. So I enjoy that I can take care of patients of all ages and that I can take care of patients for a snippet of time or over a very long period of time. I love returning functionality to patients. So as a lot of my patients will tell me, I use my hands every day, or my hands are my livelihood. And that's true for me as well. And so just being able to take away a pain or to restore functionality after a devastating injury, that's really, really rewarding. So as a kid, I always liked to do things that had, a result at the end. I like to help my dad in the garage, or, I took up knitting because I like to see a tangible result at the end of an activity, and so I really like to see that tangible result in my patients with restoration of their activities and decreasing their pain.